Welcome to the Vitamin Professor podcast, brought to you by VRM Media, publisher of vitamin retailer and nutrition industry executive magazines, in partnership with Nutraland USA. I'm your host, Gene Bruno, Professor Emeritus of Nutraceutical Science and Chief Scientific Officer of Nutraland USA. Now, the purpose of this podcast is to help educate the dietary supplement industry about the science of nutraceuticals and other relevant topics. If you like what you hear and see, don't forget to like and subscribe. Now, let me tell you a little bit about our guest today. Dr. Vincenzo Mollace is currently the Dean and Director of the School of Pharmacy and Nutraceuticals at the University of Magna, Græcia at Catanzaro, Italy, and Professor of Pharmacology at the University of Rome, Tor Vergata. He earned his Doctor of Medicine degree at the University of Messina, Italy, in 1983, and he completed his residency in cardiology at the University of Milan, Italy, in 1987. From 88 to 2002, he served as assistant professor of molecular pharmacology at the universities of Milan and Rome, Tor Vergata, and served as a full professor of molecular pharmacology at the University of Rome Tre from 2002 to 2014. Professor Mollace also served as Dean of Molecular Pharmacology at the University of Catanzaro, Italy from 2002 to 2016. In addition, he currently holds the position of Director of Research Center for Food and Safety and Health, UMG, focusing on nutraceuticals as the field of research. Professor Mollace has authored more than 200 full-text papers in top-ranking journals in the area of nutraceuticals. Today, Dr. Mollace will be talking to us about Bergacyn from HP Ingredients. Welcome, Dr. Mollace.
Thank you very much, Gene. I'm really happy to have the opportunity to discuss with you and with attending people regarding this new combination product, which is deriving from bergamot polyphenolic fraction and the extract of a special artichoke, which is called Cinara cardunculus. It's a wild type which grows spontaneously in the southern area of the Calabrian region in Italy. And bergamot polyphenolic fraction is known as an extract which is deriving from this fruit, which is growing mostly in the southern area of Calabrian region, and which has been studied in the last 20 years by our and other groups for the very rich component of antioxidant polyphenols, which is in the amount of 38 to 40%, and which is rich in naringin, rheochitrin, neosperidin, and other two glycosylated flavonoids, which are brutteridine and melitidine. The last two are able also to combine antioxidant properties with the inhibition of the hydroxymethyl glutaryl-CoA reductase, which is the enzyme which is targeted by statins, which are the most widely used drugs worldwide to reduce the concentration of serum cholesterol. So the combination of both products has been shown to produce beneficial effects which are known for bergamot derivatives, and especially for reducing serum cholesterol, triglyceride, and serum glucose. But recently we combined the BPF deriving from bergamot juice with Cinara cardunculus extract, leading to Bergacyn. And it's not just a combination of a mixture of two powders, but Bergacyn is deriving from a simultaneous extraction from both bergamot juice and Cynara extract, leading to a new product which combines the properties of polyphenols of bergamot with other antioxidants such as luteolin, which is concentrated more than 12% in Cynara extract. And other compounds are sesquiterpenes such as cynaropicrin and derivatives from the caffeic acid.
So Dr. Mollace, I just got to tell you something. I love this combination. I love it for a couple of reasons, not the least of which is because the bergamot itself comes from the area of Italy where my family came from, that Calabria region. But, I really think this is an awesome combination. And, I have in my career, I've done a lot of formulating, and I've used bergamot a lot in formulations. And the bergamonte material itself, because it's such a well-researched material. But I have a question for you. I think, one of the things about the polyphenols in bergamot is that it's shown value for metabolic syndrome. And I would like you, if you would be so kind, to explain to our listeners what exactly is metabolic syndrome, and what's your experience in using bergamot itself for metabolic syndrome?
Well, metabolic syndrome is an endemic disease, as you can imagine, in industrialized countries, and is a disease state which is mostly deriving from lifestyle changes, high intake of calories, and fat foods, especially the junk foods, which unfortunately in young population are dominant compared to natural products. Yep. And all those combinations lead to overweight, high triglyceride, diabetes, hypertension, and all those conditions increase cardiometabolic risk. So the most relevant aspect which characterizes metabolic syndrome is the accumulation of fat in the liver, which is known as a non-alcoholic fatty liver disease, or NAFLD. And it has been demonstrated that NAFLD is associated with the development of myocardial infarction and stroke. So seems to be a huge correlation which increases the risk for developing cardiometabolic disease.
Yeah. And the combination of the bergamot and the wild cardamom, that's really been found to help counter that liver dysfunction, from what I understand. And that's what you've seen too, right? You've seen it impacted this and really helped.
Well, the potential of this combination has been demonstrated in both preclinical and clinical studies. Perfect. In which it has been demonstrated, the data have been published in very prestigious journal. Both compounds have been tested in under experimental conditions and different settings, both in vitro, in vivo, in animals, and in humans, with more than 70 papers which have been published and more than 15 clinical trials. And these have been published in scientific reports of Nature and top-ranking journals. And in all those studies, it has been found that the liver is the crucial point to switch on or off the development of non-alcoholic fatty liver disease. And we will discuss also on the systemic fat, but especially in the liver, an accumulation of fat, as you can find in non-alcoholic fatty liver disease, leads to damage in the packaging system for the lipids are transported through the body in order to get peripheral tissues. In other words, in the liver, you have the packaging system making lipoproteins.
Yeah.
And the way of making lipoproteins is essential in order to understand which are the cardiovascular implications of liver dysfunction and non-alcoholic fatty liver disease. In subjects with metabolic syndrome, there is a change in the size of lipoproteins, especially LDL, are packaged in a very small and compacted size, which tend to undergo oxidative stress and produce damage in the vessels. This process is interacting with the blood vessels, but is moving from the dysfunctional liver.
What you just described of the packaging issue of cholesterol and its products, is that the mechanism by which Bergacyn works, or is there some other mechanism that it's working by?
Well, as you can imagine, there is multiple actions deriving. When we are talking, you are a master in this area. But when we are talking about a phytochemical or an extract of active ingredients deriving from plants, obviously the mechanism of action is multi-action or multi-level. Especially this product which combines polyphenols of different dimension and properties with circuiterpenes such as cynaropicrin and with caffeic acid derivatives you can find in the Bergacyn. So the first relevant effect, as we described, is a reduction in liver deposition, which makes the liver able to release in the bloodstream better lipoproteins. This is the first consistent mechanism. The second one is mostly related to the reduced formation of inflammatory molecules such as cytokines, which produce inflammation in the vascular wall. The third one is an antioxidant effect, which is mostly related to polyphenols, but especially we have an improvement in the secretion of very good substances such as biliary salts and acids from the liver, which improves the digestion of lipids at the intestinal level. So the combination of these effects lead to the properties of Bergacyn.
And consequently, the reduction in cardiometabolic risk, sounds like.
Absolutely. The consequences directly in the vessels and in the liver, but we have a series of advantages mostly related to the reduction of systemic inflammation. You know that systemic inflammation is the major topic to date,
Sure.
Connecting metabolic disorders with, for instance, brain disorders and cardiovascular disease.
And so one of the things that I had read a little bit about, and I'd like you to expand on, is I know that recent studies have demonstrated that the Bergacyn combination promotes fat browning in patients. Could you explain fat browning to our listeners and what the implications of it is for cardiovascular health?
Well, we use the term fat switch in order to better understand that there is a crucial change in the phenotype of fat. So it's not just a matter of overweight, but also the qualitative composition of the fat is crucial for understanding which are the implications of liver dysfunction and metabolic syndrome with the connecting to the cardiovascular system. And the interaction with different kind of fat is crucial. So basically we have a visceral fat which is the one increasing in subjects with overweight. But this is also combined with a reduction of the brown fat, which is the one we have in interscapular region, which is positive. The reason is related to the fact that the visceral fat behaves like an endocrine system which releases substances such as adipokines and cytokines, which produce a damaging effect in cardiovascular system. And the brown fat tissue is the positive one, the one generating antioxidant and anti-inflammatory substances. So Bergacyn not only reduces the overweight, we have a reduction of body weight composition and especially of the fat mass, but we have also an increase in the brown adipose tissue through the browning mechanism, which is crucial in order to enhancing the positive cardiometabolic responses you can expect when using Bergacyn.
So that's pretty nice, because if for our listeners who may not know, the visceral fat that Dr. Mollace is talking about, that is, if you think about, somebody that we say, oh, he's got a beer belly, or, kind of an apple shape, that extending of the stomach is really more visceral fat than the fat right under the skin, the subcutaneous. That surrounds the organs, kind of pushes out and gives you that larger appearance. And so by reducing the visceral fat, you have many of the benefits of that. So all of these compounds that Dr. Mollace is talking about that have negative effects on us, you've reduced that, and the brown fat is something that is very beneficial for that. You actually have more thermogenesis, more fat burning going on in brown fat. So something that can actually help improve that situation is pretty awesome. And that's why I wanted to just take a moment to expand on that. So this browning of the fat, as it were, that has huge implications for cardiovascular health. So thank you for explaining that. And now I have another question. One of the things that's very popular today in the nutraceutical business is products that impact our gut microbiome. Probiotics, prebiotics, even postbiotics. But as I understand it, the Bergacyn has a beneficial effect on the gut microbiome. So I would like you to explain a little bit about that and what the relationship of that is to vascular protection.
Well, in the last 20 years, we have been widely studying the potential effect of gut microbiota alterations related to the cardiovascular system. In particular, we started working on the potential effect of E. coli lipopolysaccharide, which is an endotoxin released by intestinal bacteria. But we did not understand which was the potential implication for cardiometabolic disorders. So recently we demonstrated that the dysbiosis, which is the alteration of the bacteria into the gut of obese subjects or people undergoing dyslipidemia. In those subjects, we have demonstrated that E. coli lipopolysaccharide or endotoxins may cross the barrier represented by epithelial cells in the gut and then to get the general circulation. But first they go through the liver, in which they stimulate TLR4 receptors and release cytokines. And this effect is able to produce a consistent damage in cardiovascular systems, as the low-grade endotoxemia, which is generated by dysbiosis, is able to stimulate damaging enzymes such as cyclooxygenase, the one inducible, and the inducible nitric oxide synthase. So Bergacyn has been clearly demonstrated to rebalance the equilibrium in the gut of different bacteria, thereby restoring the normal responses related to the gut microbiome. Gut microbiome is not able to produce by itself damage, but when it's altered, you have the release of endotoxins. Bergacyn resets this response and produces gut benefits and improves gut health.
That's fantastic. That's sort of an unexpected benefit that you get from Bergacyn that you didn't that most people wouldn't expect. Well, now what they are going to be surprised about, having heard what you have had to say already, is that research is demonstrating that Bergacyn can help with diabetic people. And what are the benefits that somebody with diabetes might expect to see if they're using Bergacyn, hypothetically?
Well, you know that diabetes is a complex disease in which it is crucial to identify which are the early changes occurring in vascular wall and in the heart. You know that one of the major implications for diabetes is the development of diabetic cardiomyopathy. In addition, it is known that both kidney and the retinal vasculature are impaired at the early stage of the disease when there is no other symptoms by the occurrence of diabetes. So what is required is a very early intervention in order not only to correct the glycemia and serum glucose, but also in identify the biomarkers which are correlated to the occurrence of diabetes. And a crucial aspect which you can find in any disease which involves endothelial cells and endothelial dysfunction. And myocardial dysfunction is represented by the damage in the mitochondria. You know, mitochondria are the organelles in the cell which produce energy and which maintain an antioxidant state. And Bergacyn is targeting, especially in diabetics, mitochondria, thereby improving the metabolic conditions and preventing the occurrence of vascular damage, which is associated to the diabetes.
Awesome. I in my family, I've had two uncles who died from complications from diabetes. One cousin who also died from that, all on the Bruno side, by the way. And so it's an area near and dear to my heart, just, giving the situation in the family. So I'm always pleased to hear about, something that is going to be beneficial in that regard. So sort of the last thing I want to address is, since Bergacyn has anti-inflammatory properties, do you expect that it is likely to be used more extensively in both vascular and non-vascular inflammatory conditions?
Oh, the disease we have been discussing during the interview are diseases which represent the new class of inflammatory, systemic anti-inflammatory disease. Metabolic syndrome, hyperlipidemia, non-alcoholic fatty liver disease, and diabetes are all representing a condition which generates a systemic inflammation. It's a concept of inflammation which is quite different to the one we have been studying in the last 50 years. We supposed that inflammation was just joint disease, skin disease, respiratory disease. To date, we are obliged to include diabetes, metabolic syndrome, non-alcoholic fatty liver disease, in the area of systemic inflammatory disorders in which different organs, including the brain, are involved. And we do believe that Bergacyn is relevant in order to protect subjects undergoing general disease such as the one we described. But we are studying also the implications of other systemic inflammatory disorders in which for example, an immunomodulation is required, and we have evidence that we have a rebalance also of immune response. And finally, we have also evidence, for instance, in subjects with high uric acid, which is another emerging disease, which may produce consistent cardiovascular damage. We have a benefit, and the clinical trial has been published in Frontiers of Endocrinology last year. So we think that is a work in progress in which we are learning a few things regarding the disease, but fortunately we are also trying to find natural solution in order to prevent this kind of disorders.
Very, very good. Well, Dr. Vincenzo Mollace, I thank you for joining us today, teaching us a little bit about Bergacyn, teaching us a little bit about liver disorders, about metabolic syndrome, about diabetes, and mostly about how Bergacyn can help to address all of these issues. So, folks, I just want to say to you, if you like what you heard, don't forget to like and subscribe. Thank you again, Dr. Mollace.
Thank you very much. Very kind.